Hello and welcome to our CTSNet Roundtable. Today we'll be discussing the use of social media for academic promotion. My name is Mara Antonoff and I'm a thoracic surgeon at MD Anderson Cancer Center in Houston. Today I'm joined by some outstanding experts on this topic. Let's begin by getting to know our panel. Can you all please introduce yourselves?
Hi, I'm Dr. David Cook. I'm a head of thoracic surgery and the vice chair for faculty development at UC Davis Health in Sacramento, California.
My name is Shanda Blackman, and I'm a thoracic surgeon at Mayo Clinic in Rochester, Minnesota. I'm also the president of Women in Thoracic Surgery.
And I'm Jessica Luke. I'm a first-year cardiac surgery resident at the University of British Columbia in Canada.
Terrific. Dr. Cook, can you start by giving us an overview of what types of activities on social media can merit attention or credit for academic promotion?
So in the current academic setting, social media is very prevalent and it's a good tool for dissemination of scholarly academic work. And because of that, many institutions credit some time with social media in regards to your promotion packet or merit advancement. What you can do, it may not be a large part of the calculus, but at least it's some part of the calculus. And what you do is you measure your impact of your dissemination strategy. So if you write a blog, how many page views are there to your blog? If you run a tweet chat, what were the impressions of that tweet chat and its reach?
Terrific. Dr. Blackman, can you tell us a little bit about how one can be involved in these types of online activities?
Yeah, so it's very easy to register for an account for Twitter, register for a Facebook account, to get involved in Disseminating. One of the things that I recently did was, as I have visitors coming from all over the world that come to Mayo Clinic, they want to see how our operations run, they want to see how we do cases, and then they want to contribute somehow. Well, they don't have direct access to patient records, but they want to let people know that they were here, they were observing. And so one of the things that we've started to do is on Disseminating or on the other websites, let them publish a story or a review or a case presentation that's anonymized on one of those other websites that doesn't necessarily go into the annals or another case report journal, but it allows them to engage and advertise to the other people that are involved in referring patients to them that they had this meaningful interaction. We've also started to create ways to connect with other institutions. Recently, when I was going up for promotion to full professor, you have to have an established international reputation. And like what David Cook was saying, it's very important to have a situation where you're invited to give international talks. Well, if no one knows about you, they're not going to invite you to give any international talks. So how do you get an international reputation? Well, one of those ways is to really start to get involved in content that goes into other countries, to publish videos, going through CTSNet, putting your videos online, tweeting some of those to enhance the exposure of those videos. I put videos on Facebook so that other people that I'm connected to on both personal and a professional level can have access to those. And then they get to know you. It enhances your practice. And then the next thing you know, when you go up for your promotion, you can establish, yes, I've given international talks because people learned about my activity. So,
what about taking a step back before you're ready to go for promotion when you're still perhaps just a trainee? I'm interested in Dr. Luke's perspective. Some may consider online activity to be a fairly accessible route of scholarly activity for trainees. I'm wondering, Dr. Luke, if you can speak to this extent at all for us?
Yeah, thanks very much, Dr. Antonoff, and I thank you for introducing me to Twitter. Actually, 3 years ago, exactly at the Society of Thoracic Surgeons annual meeting in Phoenix in 2016. And since then, these past 3 years have been absolutely amazing. Twitter and social media has done remarkable things for my career. And describing it in terms of the Society of Thoracic Surgeons' mission to provide the highest quality of patient care through education, research, and advocacy, dividing it by the goals and objectives of the society to foster collaboration and connection. Social media does that by leveling the playing field and allowing everyone to have the opportunity and chance to participate at the table that breaks down barriers of time, geography, location, and that allows networking and mentorship for people such as myself or anyone else who perhaps may not have specific types of mentors or exposure to women, for example, in thoracic surgery at their own institutions, and they're able to do that internationally by social media. Furthermore, it also helps in diversity and inclusion with the hashtag I look like a surgeon and hashtag New Yorker cover challenge. It helps build campaigns to break down barriers and biases.
So you've talked a little bit about not only the way that trainees can use social media to engage in scholarly activity, writing blogs, getting disseminating their own articles through tweeting them out, journal clubs, things of that sort. But you talked also about mentorship and networking. And I know we're mostly aiming to talk about promoting your own academic career through social media, but an important part of anyone's promotion and advancing in their career is having a good mentor. So you talk about reaching out to mentors through social media, and I'm curious for Dr. Blackman and Dr. Cook, how do you feel if you are reached by a mentee, a prospective mentee, if they contact you through social media seeking your input and your advice? Do you feel that that's a reasonable approach for a mentee to take?
It happens all the time. We put a video out on CTSNet, a day in the life of a thoracic surgeon, and since that video is launched, I've probably been contacted by 100 different young women who thought, you know, I could never do that job. That job doesn't apply to me, or I don't want to do that job because I can't have a family, or I won't have a well-balanced life. And so it was really interesting to see that people would reach out, come out of the woodwork, literally, through social media, saying, can I, you know, I'm in college, can I come spend a week and shadow you? Or I'm in, you know, med school, can I do my elective with you? I didn't know about you, and I saw this, and, you know, I connected with a young woman named Christelle Benjamin, who's in Colorado, who absolutely had no idea how to get into a career in cardiothoracic surgery. She's a college student. Yeah. She came, spent time with me, and I continue to mentor her and keep touch with her through social media. That's how we stay in touch. Yeah. So it's a whole new avenue. You know, we're in the operating room, we're in clinic. We don't have the ability to talk on the phone all the time. You know, phone time is almost impossible when you're a surgeon. But at 2 o'clock in the morning, I can talk to anybody. Right. So it's a really great way to connect.
Right. What about you, Dr. Cook? What's your perspective?
No, I think those are excellent points. At the Society of Thoracic Surgeons meeting and other meetings, I'm always surprised about trainees and learners coming up to me and say, I follow you on Twitter, I took this advice, and et cetera. But another key point to flip that around, for promotion, at most institutions, for promotion, you have to show evidence of education, and you have to show evidence of mentorship. Well, oftentimes mentorship falls under that rubric of education. And one of the challenges of cardiothoracic surgery is being exposed to different levels of learners. You may not be, as a faculty member, you may not be exposed to medical students. You may not be exposed to general surgery residents who rotate on your service. But through social media, oftentimes you're mentoring through the digital landscape and creating these relationships, as Dr. Blackman just described, and those can be incorporated into your promotion packet as you discuss your mentorship activities.
Go ahead. I was just going to say, it helps also, I feel like I get to know my residents better, I get to know my patients better. It kind of puts you into contact with that part of the world that you're isolated from while you're stuck in the operating room. Yeah. And one of the things that I love to do is get on social media and follow some of the esophageal cancer support groups or the lung cancer support groups. And you learn like what your patients care about, what, you know, symptoms they might have, what am I missing in my research, where's a big gap, where are these people not getting what they need in medicine. And it helps you to tailor what you're doing as a physician and a surgeon to try to, you know, we've created an app that helps to solve all these problems that I would see on social media, people complaining of symptoms, nobody knows how to deal with them, and now we're solving those problems. So it's a lot more than just academic promotion.
Right. So that's an example of co-learning. So not only are patients and learners learning from us, but we learn from our patients. Through lung cancer social media or hashtag LCSM, we learned about pain as a major patient-reported outcome after lung cancer surgery. And we investigated that further, and that actually led to extramural funding to study that. So that's an example of the co-learning that can occur through social media developing into an academic product.
You know, one of the interesting concepts when we talk about scholarly activity and social media, we generally think of two pathways, either using social media to disseminate our more traditional scholarship, like our presentations at national meetings and our publications, or the converse of getting academic credit for our social media work, like turning blogs and tweets into lines on our CV. One interesting abstract that I saw that's being presented as TS this year actually relates to Twitter activity and individuals' presence on Twitter and their associated H index of that individual, which I thought was absolutely fascinating. And I think there's a lot of ideas we may have about what may lead to that correlation. Of course, it may be just related to the fact that individuals who are more productive and interested in innovating and disseminating activity may also be individuals who are more active on Twitter. But it's a really interesting concept for us to study looking forward as to whether individuals who do have a heavy social media presence are going to influence their H index, which I think does make a difference when it comes to promotion and tenure. I'm not sure what your folks' thoughts are on that.
I think Mayo Clinic's done a lot of work at trying to measure that impact. The H index is really important. Trying to find a way to create a dashboard for how you interact with the world as a physician. There's a really beautiful book that's written by Victor Montori, and it's called The Patient Revolution. And patients just aren't really content to go to a doctor they've never heard of, they've never seen, they don't know anything about. And you were saying this in one of the early career workforce session earlier. Patients know you by the time they come based on your online presence. And if patients don't feel that connection, we have less and less time with our patients. We're constrained by our hospitals to have a 15-minute visit, and during which that visit you have to understand the needs of your patient, consent them for surgery, look at their images, make a decision. There's a lot that has to happen. Using social media to make that connection with your patient that you might not otherwise be able to make in that short visit allows you to really start to understand each other and come on common ground and let them start to bond with you earlier, which is meaningful, I think.
Sure, absolutely. I'm wondering if we can share with our audience some tips. You mentioned that Mayo is taking efforts to recognize individuals' digital portfolios and some of the work that they've done on social media. And I think we each have different ways that we keep track of what we do on social media. So for me, our CV at my institution is fairly standardized. We have to use a set form. So I've added a section at the end of my CV that includes a lot of my online presence, including chats that I've moderated, materials that I've curated, blogs that I've written, and I have separate sections for each of those different aspects. And I'm wondering if each of us could maybe share our best practices or our tips for individuals to be able to log their type of social media activity so that it can be accounted for. Dr. Luke, do you have any recommendations for how you would collate it as a student and as a trainee?
Yeah, so I'll start integrating that into my CV. And basically, I have a mission statement, so a professional mission statement, as well as a digital portfolio mission statement. And I also have specific lines on what was done, for example, tweets, blogs, podcasts, media interviews, etc., and they all curate together. And I think that it's important to separate them by category, but then also not just talk about the quantity of them, but also the quality. And that can be done by many metric systems, such as alternative metrics or alt metrics, impressions like Twitter analytics, and engagements, and there's so many different ways to evaluate that. And also I think the next step would be to say what and who did I impact, and who was I able to affect and interact with, and then also to then take it a step forward would be to inspire and promote our specialty in that. And I think that adding all those categories and being able to quantify those is great.
That's terrific. Dr. Blackman, do you have a way that you've incorporated this into your CV, or any way that you're showing your institution what you're doing online?
So we have a re-aims formula, and when you publish something, it automatically goes into your re-aims. It's sort of a typical Mayo Clinic CV that you have no control over putting something where it goes in the spot. So what I've done is I've created a separate page.
Yeah.
And then that page is basically a summary of the social media impact that I feel like I've made as a physician and a mentor and a provider. And so it's a separate little attachment that I can staple on the back of my CV.
That's essentially what I've done by adding an additional page, a section at the end of my very standardized MD Anderson CV, but it seems to work. Do you have any other tips about how you're doing it?
Just similar. I have a section that is additional non-peer review and alternative media. And in that section will be links to tweet chats, links to blogs, as well as referencing, say, TV appearances and other media aspects of things. But I do agree that you have to itemize your CV and list it, because you will forget all the great things that you do, and you won't get credit for it by talking about it.
Well, that's terrific. And then we had spoken earlier about how you can use social media as a means of getting academic credit for your online activity, but also a way to disseminate your more traditional scholarly activity. Do anyone of you have some tips about how to do that, how to disseminate some of your more traditional works?
So I started out on the Annals editorial board with the creative learning section, and we started to establish the different ways that we could promote articles and enhance reference citation. And one of those ways was to form a Facebook page, a Twitter page, online media content, so that we could promote our own articles and enhance exposure. And I think that's worked really well. And then you've taken it another step for TSSNet.
Yes, we've worked really hard with the Thoracic Surgery Social Media Network to promote articles from both Annals and JTCVS periodically on a monthly basis, but also through occasional tweet chats, both in the general thoracic and adult cardiac world. And we've even had some through the trainee group. Dr. Luke is part of that group, and there have been phenomenal articles related to surgical education of cardiothoracic trainees that have been promoted through that network as well. What about for the individual writer, for the author? Dr. Cook, Dr. Luke, do you have any thoughts about how an individual, once they have a paper published, how they can really get it out there?
Sure. One thing I would recommend is having a good relationship to your institution's social media team. So Mayo Clinic is on the vanguard for that. MD Anderson is very mature in that as well. And at UC Davis, we have a very good social media team. So they follow me. And so, for instance, at the STS annual meeting, my colleagues and my trainees are presenting data. And what I will do is I will tweet out information about their abstracts, along with a reference to the online program book, as well as their picture. And oftentimes I will either embed my institution's Twitter handles into the photos. So that way their social media handlers are aware of what I'm tweeting. Even though they follow me, they'll still be aware of what I'm tweeting, and then they can amplify that message by retweeting it as well.
Perfect.
So that's an easy example of just partnering with your social media team. Let them know that they're aware. My social media team knows that I'm attending the annual meeting, and so they are, although a lot of content's on the weekends, but when Monday and Tuesday comes around, then they are aware to look out for what I'm doing.
Terrific. Dr. Luke, you've been a very prolific writer in your early career. Can you tell us what steps you take briefly when you've published a paper to ensure that you're disseminating it out to as many people as possible?
Yeah, I think that publishing paper is one thing, but having it be able to affect change and impact others is the next thing, and that would be social media is definitely an avenue to be able to do that. So I think it's important to get our work out there, and especially as trainees as well. And ways to do that would be to create a visual abstract is one way, to have a tweetable slide, and be sure to include your Twitter handles for your authors, your institutions, and relevant hashtags, such as the Thoracic Surgery Social Media Network, hashtag TSSMN, for articles in cardiothoracic surgery, to be able to let your audience know what handles and what hashtags would be relevant to include to ensure that you get the maximal impact in the social media tweets. Other ways to do that would be, especially at conferences such as the Society of Thoracic Surgeons, would be to pre-tweet and let people know that this is my session, it's happening at X p.m. and this is what's going to be discussed and it's going to be interesting, and see you there. And then during the conference to take questions from Twitter polls. Perhaps some people aren't able to attend in person, but would love to contribute to the discussion. So that's one way to have discussions in the room, but also to be inclusive of others who aren't able to attend.
I would also say only show your title slide. You don't want to show your content because you've contractually agreed with STS to show the content at the meeting. So be careful about tweeting your slides out before you're talking.
That's right.
The lawyer that's not within me is just panicking right now. So there is a licensure agreement when you work with an organization, and you want to be really careful about when you send images or digital content out, who owns that? I think that's the gray zone in social media where you can potentially start to get into trouble. When you take something that belongs to a meeting where you developed the paper, presented the abstract at that meeting, and say you go into the studio and you record a voiceover of your presentation, and then you put that out on Vimeo or YouTube, that's actually technically a violation of the contract that you made with that organization. So you want to be really careful about how you do that, and always ask for an opinion. We've got some great opinions on this panel, so we're always happy to provide advice.
Absolutely.
One key issue also is HIPAA. Be cognizant of patient confidentiality when you're dealing with things that could be case reports or other things through social media. Oftentimes, if there is an interesting case or an interesting treatment plan that I know that I want to disseminate or in a scholarly manner, I will get a media release signature from that patient ahead of time. And know that this may go out through social media, and then they are generally very happy and accommodating, but getting a media release form signed by them.
And I think this turns back to your comment earlier about establishing a good relationship with the social media folks at your institution, because they're usually going to be able to advise you on best practices, as well as making sure that you're not violating any laws, rules, or hospital policies. So I think establishing those relationships is always a great idea. I know we're running short on time. Does anyone have any closing thoughts that they'd like to share with our audience about academic promotion and social media? Dr. Blackman, any thoughts?
Well, I just want to say, I think, I decided to go into academic medicine and not private practice because I feel like it's important to give back to the people that I work with. I really enjoy mentoring young surgeons, and the honor and the privilege to work with young residents is beyond measure in gratification. If you think of going out and operating on a patient, certainly you change their life. You write a paper, and the impact of that paper will change practice. You teach someone how to do a surgery that's a life-saving surgery, and the impact of you doing a surgery is now enhanced, and the ripple effect goes out even greater. Social media is just another way that you can have an impact. And if you think of yourself as a positive person who has decent thoughts and wants to share them and wants to make the world a more positive place, I'd say there's a lot of room for that, especially nowadays. So I really think it's important to engage and to try to move that dial a little bit. If you care about diversity, this is a great way to promote diversity in a very positive and meaningful way, not using social media to complain or whine, but to push your agenda and really start to have a voice beyond the OR and just in the clinic.
Thank you very much.